Interns with pay. The medical interns are graduate medical professionals, medical doctors, dental surgeons, pharmacists, nurses, and midwives, who by constitutional mandate must undergo a 1-year supervised practice before they are given a practicing license to practice their profession. Medical interns are a critical workforce offering 75% of medical care, including emergencies and on-call coverage in our health system. Interventions that are most critical in ensuring that life is preserved. Northern Uganda is the most impoverished region in Uganda, with a poor education system that cannot compete favorably with other regions. This makes us fail to qualify for government sponsorships on national merit. The few of us who are able to study do so under private sponsorships. On the 11th of May 2023, in a closed-door meeting convened by the Right Honourable Prime Minister, with Vice Chancellors, Deans, hospital directors and other stakeholders, it was resolved that government should not pay graduate medical interns who were under private sponsorship during their undergraduate medical training. As interns who hail from this northern region, whose parents and communities have sacrificed so much out of meager resources to train and raise medical doctors, dental surgeons, to train nurses and midwives, we find these proposals unfair, marginalizing and frustrating. Consequently, many of our colleagues, majority of whom were under private sponsorship, will drop out from this internship. For the few interns who will dare to take up internship without pay, the quality of their training will be undermined due to low motivation and absenteeism as they go about squashing around for survival. This policy will only discourage many students from aspiring to take up medical professions. This uninformed policy will further frustrate the national and international efforts to reduce the appalling doctor-patient ratios in our country, which are currently standing at 1 doctor to 25,000 Ugandans, against the recommended 1 doctor to 1,000. Therefore, fellow countrymen, ladies and gentlemen, this policy, in conclusion, is a direct attack on our current efforts as a country to attain the Sustainable Development Goals, universal health coverage, Agenda 2030, and the Uganda vision, like we so proudly stated in 2040. So our recommendations as graduates to interns from this region are, from the background, we recommend that the government should urgently deploy medical interns